5 lite. And I just want to say, first of all, we have some special thank yous that we have to give this evening to the Arlington, Virginia chapter of the Links Incorporated for hosting this week's What, How, Why Wednesdays edition. And it's featuring their very own Dr. Kelly Bolden. We're going to be having a lot of insights tonight on plastic surgery and what that entails and whether you should or shouldn't have it, and so much more. And we do have to acknowledge some very special guests that we have with us tonight. We have the National Health and Human Services Director from the Links, Dr. Nikki Martin. We also have the Arlington Links Chapter President, Suzanne Walker. And we have the Arlington Links Health and Human Services Chair, Dr. Yolanda Holmes. Thank you all for being here tonight. Thank you for everyone who has joined. And this is a special hello on behalf of the North Broward County chapter of the Links Incorporated in Fort Lauderdale, Florida. So welcome all of my Links sisters for being on tonight. We are going to get started right now and really want to get into this. If you have any questions, please put them in the chat and we will get to those tonight before we get off. But we definitely want to get started because we know you guys have a lot of questions. So at this time,
on, so they're on. So everybody's good. So good. We're going live. There's a little bit of a delay, so we better just kind of let people know they may experience a little bit of a delay, but we are on.
We are on. And speaking of on, she is always on and looking beautiful. Dr. K, tell us all about the wonderful lady that we have tonight that's going to be talking to. Listen, I am just in great company. I have two Black female doctors here with me, an anesthesiologist and a plastic surgeon. I'm sure my mother who's watching is probably saying, what did she do wrong? I didn't make this cut.
Well, first of all, let me thank my fellow Texan sisters. First of all,
Yes.
Dr. Bolden grew up in Clear Lake, and Tamara G hails in from Marshall, Texas. We all know the movie, The Great Debaters. But again, we won't have that segment tonight, but we're all calling in from the Houston, Galveston area. So big shout out to that community. Dr. Bolden, I know you're so busy, so I am pleased to invite you to this, what I call What, How, Why. And as a physician, you already know that we encourage our patients to talk to us. Right. And I'm sure they talk to you before they get ready to have plastic surgery. They ask them, what am I going to have? How are we going to do it? And why are we doing this? I know you have to answer those three questions. And I think it's always important to let everyone know, hey, how do you become a plastic surgeon? And so if you allow me to tell why you're so bold and you're so beautiful, and we just want little girls to look up to you. We want other women to know that they too are bold and beautiful as we celebrate Mother's, Happy Mother's Day, new mom. Yes. And it's also Women's Health Acknowledgement Month, whatever we want to keep saying, but this is the month to basically celebrate women. So happy to have you, and just want you, people to understand that, this is a long road, but you've done it with grace. It can be done with grace. So, you're a Spelman alumni, first of all. A big shout out to your HBCU. Your alma mater is so well respected. You also then left there. Well, let me add this fact. You also did a dual program with Georgia Tech. So yes. You started with STEM a very long time. And so you are an chemistry major and then went over to Georgia Tech and became engineering, right? Yes. Engineering. So that is a feat in itself. I was a mathematics major. And then you went to Baylor College of Medicine and decided that you wanted more of the good stuff and the good life, right? Sleepless night, and went to Emory. And let me tell you, I trained at Emory as well. So that's no small feat. It is one of the top premier programs in the nation. And from there, matched at University of Texas Southwestern in Big D. So let me just tell you, again, no small feat. To ultimately become a plastic surgeon, and then added some more to that when you decided to train in microsurgery and plastic surgery at Mercy in Baltimore, and brought your talents all the way back home to another HBCU, Howard, as an assistant professor, and started your own practice. So in Chevy Chase, Coutura, right? Is that right? And so just phenomenal list, and I had to run it down. I hope I did you justice. And I
That
just
was great. That was better than I could have done, and more concise too. I would have been like all the way out here. So good.
So great. So Tamara, you know, I'm gonna let you be the host of the most tonight, and you are absolutely, I'm gonna give you the floor.
Okay, well, I would like to ask Dr. Bolden about her practice. You know, we now know all of the education that you have to do, but
Mhm.
you know, what is your practice? What does it entail?
Okay. So, you know, I consider myself very blessed as far as the setup of my practice. You know, as Dr. Case said, I started out, what I really wanted to do was, or what drew me to plastic surgery in the first place was really breast reconstruction. I operated with a few plastic surgeons when I was a general surgery resident, doing breast reconstruction and reconstructing breasts from using people's own tissue, abdominal tissue, tissue from their back. And I was fascinated. I mean, I just thought there was nothing better in the world. And as I got through my training, what I recognized was we had all of these amazing surgical techniques, very advanced surgical techniques, and lots of patients were getting these procedures done, but there was a very notable population that was missing, which is kind of a thread throughout the, you know, the medical field, which is underrepresented and underserved populations. So when I was in Baltimore, I knew I wanted to practice in a major city. Houston was an option because I grew up there. I'd spent a lot of time in Atlanta, so that was an option. But DC was also at the top of the list, and my family happened to be here for various reasons. And then Howard was here, and I thought, what better place that could utilize, that I could utilize my talents and take advanced surgical techniques and reconstruction to an underserved or an underrepresented community. And that's what really prompted my practice at Howard University Hospital. I still do that. That's still my biggest passion. But what ended up happening was, as I got there, I recognized there were other areas that really needed, really needed my expertise. So I did breast reconstruction. I also developed a pretty large post-bariatric practice. So after major weight loss surgery, patients have a lot of extra skin and soft tissue. And so I really delved into that and doing kind of body contouring, for lack of a better word. And then an additional step to that, I actually was introduced to some of the transgender community and transgender operations for gender affirmation. And that sort of took hold as well. So that encompassed my reconstructive practice. And I did that really for the first 6 to 7 years that I was there. Throughout that period of time, I had the privilege of knowing Dr. Elliott Battle, who probably a lot of people on this call know. He's definitely, a premier dermatologist in the DC area, premier dermatologist, really known nationwide for his expertise in skin of color. And he gave me the opportunity to then introduce my surgical skills to that patient population on the cosmetic side. So about 3 years ago, I transitioned my practice to mostly cosmetic and joined him in the practice at Cultura. But because my heart and my warm fuzzies and my passion are still in providing those advanced reconstructive techniques, I actually still am an assistant clinical professor at Howard. And I work there part-time. So I consider myself extraordinarily blessed because I just have this perfect blend of a reconstructive and a cosmetic practice, which allows me to cover the gamut. Exactly. But it allows me to take care of patients, and no one day is the same, which is what I love about my practice.
Well, so really, I was going to say, so her specialty really has evolved over the years, because you started as breast reconstruction, and you said bariatric, and then transgender, and now it's cosmetic. So you're doing a little bit of everything. But we know that cosmetic surgery is a probably billion-dollar industry in the United States, and in some areas in particular. And so many people now are getting these mommy makeovers. What exactly is that?
So great question. Mommy makeover, and some people will even refer to as mommy restoration, mommy makeover. And it's not just for mommies, but generally speaking, it is, it kind of addresses the pathology or the problems that we encounter after mommyhood and after pregnancy. So breasts look a little bit different. They may come a little bit deflated after breastfeeding, or a little bit saggy, and our skin stretches out and then it doesn't quite retract back. And so we've got that loose skin, or those stretch marks, or those stubborn pockets of fat. Sometimes it can even, include things that we don't always talk about, like vaginal rejuvenation and things like that. Because we all know pregnancy and motherhood affects all parts. And so mommy makeover most probably classically entails doing something to kind of rejuvenate the breasts and then something to restore the abdominal wall and the abdomen to what it looked like pre-baby. The reason why I say it doesn't always have to be mommies is because we see very similar things, sometimes just with aging. Some women will say, just as I aged, my breasts got saggier, my stomach got looser. And then we also see a very similar things that happen after major weight loss. So when we refer to mommy makeover, it really just means that someone wants to do something to rejuvenate the breast. That could be a breast reduction, it may be a breast lift, it may be a breast augmentation, it could be a combination. And then most classically, it would involve a tummy tuck, or where we actually remove the extra skin, tighten the abdominal wall muscles, and then do a lot of times with that liposuction to just kind of restore that contour. If we're talking about vaginal rejuvenation, sometimes that's lasers, sometimes that's things like labiaplasty, sometimes it's just, we're kind of tightening things up. That's probably not the norm. But there are some patients who will incorporate that. But generally speaking, it's usually liposuction, some sort of breast procedure, and some sort of in like a tummy tuck.
Let me, well, again, the most notable thing that you said, two things, is the butt injection fat going into the buttocks also part of that mommy makeover?
Oh, sorry, go ahead. Yep.
And then the second question, you said lasering of the vaginal tissues, which brings me to the real crux of this question is what becomes covered versus not covered. And when we talk about cost, I think that's an important thing to kind of and to include in this conversation as well.
Right. So when we talk about fat injections to the butt, so a lot of people refer to that as a BBL, or what's called a Brazilian butt lift. Okay. Or it's buttock augmentation, where we suck fat from one part of the body and we inject it back into the butt to give you a fuller, rounder butt. Classically, I wouldn't say that that's probably considered part of a mommy makeover, but it tends to be rolled in quite often with patients because they want to combine the two. In my practice, I actually try to separate them because I think that the recovery can be quite challenging. So I typically try to separate the BBLs completely from a mommy makeover, but it can be rolled into that for sure. When we talk about all of these procedures, vaginal rejuvenation, BBL, mommy makeovers, even these things independently, generally speaking, these are considered cosmetic procedures, which means that they are not going to be covered by your insurance. For something to kind of slip or to push into the reconstructive realm, which is where insurance will cover it, they essentially want to know that whatever it is that we're doing has a medical indication. And that can sometimes be a bit of a gray area. So, earlier I mentioned that I do a lot of post-bariatric work. In essence, I'm doing body contouring, but there's a medical indication behind it because, for example, if your stomach, if your abdominal tissue hangs so far that it covers up the mons area, the pubic area, hangs onto your thighs, the skin under there has a lot of moisture, you may develop rashes and skin irritation that requires antibiotics or topical therapies or things like that. That's considered a medical indication. And we can actually perform a variation of a tummy tuck. It's not a tummy tuck. It's actually called the paniculectomy.
Right.
And that just means that you're removing the excess skin. It does not include tightening the muscles, does not include any kind of liposuction. It is purely a functional procedure. So, and the same thing happens with the breast. Breast reductions are commonly covered by insurance because they're treating chronic back pain, chronic neck pain, maybe shoulder grooves, rashes under the breast, which are medical indications, versus a breast lift where you're just complaining that your breasts are saggy or deflated and you want them lifted. So there are a lot of nuances, but insurance companies are very, very, very specific about it. And it can be a challenge. So I frequently will walk patients through that process so that they have an understanding of what the difference is. But the best way that I can tell people is, when you're thinking about what's going to be covered by insurance, I always think, is it an ailment? Does it cause you, some sort of condition or some sort of medical condition that that you have to get treated for. So if you have back pain, yes.
But I was
If
going to say,
you've
Dr.
got
Bolden,
really bad skin irritation,
right.
yes. You know, if you've got what we call, you know, like a big abdominal wall bulge because of pregnancy and then you have abdominal pain, that puts you in a different category versus just saying, I want, you know, a smaller waist. I want my butt to look a little rounder, you know, which are all very valid, you know, desires. It's just that the you know, the indication is a little bit different, if that makes sense.
Right, because people think that it's vain and it's cosmetic and it's because you want to look better. But, you know, a lot of people have mental things dealing with this as well, because they don't feel good about their bodies. So, you know, I know where the insurance companies come in because they don't really want to pay for it. But if it's affecting my mental state, or if I don't feel good about myself, there are people who really don't like how they look. And so is that not ever going to be considered, you know, when it comes time to pay?
Yeah.
I mean, I think that's always going to be a challenge. You know, I always tell patients that, you know, you have to be your own best advocate. Now, the mental part of it, I do think is always a challenge, and it evolves over time. You know, I have patients who, my bariatric patients, I have bariatric patients who sometimes don't get covered because the insurance company will say, well, you haven't been treated long enough. Or, I mean, they'll even say things that sound ridiculous, but your skin doesn't hang far enough. Like, I mean, those are actually things that the insurance company will say. So there are some hard and fast indications. But I've had a lot of my post-bariatric patients who will complain because my transgender population in the District of Columbia, that's a covered benefit. It's not in every state.
Right.
But that's basically, that's a reflection of advocacy, where the transgender community went and they advocated for themselves. They went to legislators. And so it's a covered benefit in the District of Columbia because of the psychological component. But, and I'm not trying to get too medical, but you know, there are what we call DSM criteria that actually diagnose someone with gender dysphoria.
Right.
So when we start talking about the medical conditions, there has to be a diagnosis.
Right.
And unacceptable cosmetic appearance, as of now, is not a diagnosis. It's a diagnosis code, but it's an elective diagnosis code. And
insurance won't pay for it. Yeah.
Exactly. Your passion again is really you work very hard with what we call the two different strategies, what we call reconstructive surgeries, which is of course after breast cancer, and the body contouring, which you perform after maybe, like you said, medical weight loss or surgical weight loss, and someone has a lot of skin. And I understand that skin can actually cause problems with mobility. And of course, it does cause problems with the person's willingness to continue to lose weight, because the opposite of that is the skin. And people have to understand that can be physically debilitating and emotionally debilitating for a patient. And you want to encourage them to keep the weight off. Can you, I think Howard has a robust bariatric surgery program.
Yes.
Is it true? And are you involved with, do you get most of your patients from there? And are those patients African-American?
I do. So Howard has what would be considered a center of excellence for bariatric surgery. We have two primary bariatric surgeons. Most of the work that they do is either laparoscopic or robotic. So that continues to keep them, you know, at the forefront of bariatric surgery. The majority of our patients are African-American. I would say the patient population in the bariatric program, and then that kind of slides into my practice as well, is, you know, I don't have these numbers hard and fast, but if I had to, you know, kind of guesstimate, it's probably 80 to 85% African-American, and then following, or maybe not quite, but there's a mix of African-American and Hispanic. And then after that, it really will vary. And if you want to segment, it's mostly American Black. And then you also have, you know, a lot of Caribbean, West Indian, African, Hispanic, from South America and Mexico. And then the other populations are probably not quite as prevalent, but we do have white patients and Asian patients that we take care of as well. And we do see a lot of those patients, and especially in the Black community. You know, we have patients that are having considerable weight loss. And to Dr. K's point, you know, it's one of those things that, from a cosmetic patient standpoint, you think you have extra skin, but boy, you really haven't seen extra skin. And, the ramifications of having so much extra skin and the irritation and the skin ulcerations and things like that. And not to kind of be a downer and gross everybody out, but it really is a big distinction. And so sometimes it does seem nuanced, but when you see someone who's post-bariatric who really is struggling with extra skin, it's a very different patient than your mommy makeover, for example, who, isn't happy with their body, but, they're not having to bathe 3 times a day and constantly put, powder and topical treatments and creams just to keep, just to maintain hygiene. So those are kind of, when we talk about the medical differences, that's more so what we're referring to. Not that we have disregard for the fact that psychologically, absolutely, after you have children, if your abdominal muscles don't work well and you still look like you're pregnant, absolutely, that's a psychological burden. But it's a little bit, it can become that. I always tell people, you have to be the advocate. You've got to be the person who decides, I'm going to go and I'm going to push for this. And I'm going to talk to my legislators and say, this is a women's health issue. That disorder that I'm describing where the muscles separate is called rectus diastasis. That's a real problem.
Is that
I personally do think that should be covered.
Okay, because I've had friends who've had twins and they've had to have that done. Now I must say, full disclosure, I do work for the military, so some things are covered, like you say, where you work for, and so different places. And Tamara's in Miami, where there is medical tourism, and
every day, all day.
So Tamara, do you, what is the local news that are feeling? Do you think that those are cash places?
For sure down here, and people travel from across the country. Of course, it's Miami. They want to be down here. If they're going to be recovering, they want to be in 85-degree weather too. But someone actually had in the chat, and thank you for everybody who is watching on Facebook, a question, and this is a legitimate question. What type of legal issues, aka lawsuits, do you encounter in your practice? Because people are electing to do these surgeries. This is, you're not making them do them. And yet as with anything, they'll tell you, and Dr. K will tell you, some things may go wrong if you go under, so.
Kelly, we'll tag team that, because you and I know that is where you and I intersect. So I'll let you have the floor. So,
there's a reason why physicians carry malpractice, and certain fields have a much higher premium than others. And we happen to be in 2 of the fields that have a very high premium, because it can be a challenge, because we are doing elective procedures, but anytime you have surgery, it can be under general, it can be under local. There's always, anytime you do something, there's surgical risk associated with everything. I think the biggest key is, we have something in medicine that's called informed consent. And it's not just medicine, there's lots of fields that have that, but in medicine, informed consent is really, they're 2 really big words. And some people take it a little bit lighter than others. I'm one who takes it very, very seriously. And do I have complications? If I sat here and said I didn't, someone would come down and strike me. I mean, I have complications. I consider myself an excellent surgeon. I mean, I have confidence in my abilities. I think I'm an excellent surgeon, but I too have complications. But I think one of the things that has been beneficial is that I am extremely thorough with my patients. I do a very extensive informed consent. I'm also very forthcoming with my patients. I try not to promise anything that I cannot deliver. I was trained to under promise and over deliver, which I think in certain fields, it's a good thing to kind of do, because, sometimes your confidence is your biggest, or overconfidence is your biggest issue. So do I deal with medical legal challenges? Thankfully, not often, but I do think that has to do with the extent of informed consent. Bedside manner makes a big difference. And I think Dr. K can really, really talk about that, because, we go through that. So there are things that I think become part of your, when you select a surgeon or when you select your physician, those are some of the things that you do want to look for, because I always consider it sort of like, it's not a marriage, but you're going into a relationship, and sometimes things don't go right. And it's just, how do you work inside of that relationship to make sure that ultimately the outcome is achieved?
Well, I'm going to just put in that, like a marriage, the plastic surgeon is married to someone who's going to put the patient asleep and make the patient still, whatever they decide, whether it's sedation or general surgery. And again, we're a general anesthesia. So when you have a consult for a plastic surgeon, just know that you need to say who's doing the anesthesia as well. And so I think that, again, we want to encourage patients to say what, how, and why. You can do that with anesthesia. What anesthesia am I getting? How is it going to be administered? And why is that the best choice? And so again, these areas, as we've seen some of the outcomes be not favorable, we do have to ask, was it a surgical issue or an anesthesia issue, a patient had a presented issue? So all of these things are relevant when you're considering plastic surgery, whether that's a cosmetic procedure or a medical reconstructive procedure. And if there's nothing else that anyone takes away, is that please do your due diligence on who is operating on you and who is going to be putting you asleep and waking you up. And so it is all, like you said, a big marriage between the patient and the surgeon, and the patient and anesthesiologist. And we want the anesthesiologist to be definitely tied to the surgeon.
And actually, there's one comment I do want to make, because it's kind of important, and I'm so glad that you mentioned that. And this is very specific to plastic surgery and cosmetic surgery. I think Dr. K just mentioned, you have to do your due diligence. Board certification, that's something that a lot of us don't ask about. I think a lot of times we meet someone, we say, hi, I'm Dr. Bolden. And the assumption is that I have all the qualifications that I need, because I wouldn't be here talking to you if I didn't. And unfortunately, in medicine, that's not the case. So you have to ask, are you and I'll give you the very specific verbiage, and I'll give you a reason why. So you have to say, are you a board certified plastic surgeon? Don't ask them, are you a board certified cosmetic surgeon? Because there is no such thing. Well, let me take that back. There is, but it's a created board. It is not, it's not a recognized board by the National Board of Medical Specialties. There is no board of cosmetic surgery by the National Board of Medical Specialties. So there are physicians who do a and I'm going to put in air quotes, they do a fellowship in cosmetic surgery, but it is something that a group of physicians who wanted to do cosmetic surgery developed. So
they started their own board so they can do what they want to do.
They do that.
Yes, absolutely, 100%. And their website is beautiful. It is impeccable. I read it and I had to think, wait a second, are they better than I am? I mean, the way that they have put it together is quite phenomenal. So as a consumer, it's challenging, because you don't always know, and you really have to sometimes dig down to make sure that the physician that you're going to, or the surgeon that you're going to, is actually a trained surgeon, for one. There are a few specialties that also do cosmetic surgery that are board certified. So for example, ear, nose, and throat doctors can do fellowship in facial plastics. And so they are facial plastic surgeons, and they are very good if you're doing facial procedures. But by the same token, facial plastic surgeons probably shouldn't do your breasts, probably shouldn't do your tummy. You know what I'm saying? So
check it out.
Those are nuances.
They have.
Yeah, those are just their nuances. Yeah. So it's important to ask those questions. Make sure that you ask, are you board certified, and what is your board certification in?
Okay,
we're going to take some questions.
I was going to say, we got another question in chat, and want to thank everybody who is definitely giving their comments. Tracy Washington says, very insightful. Nikki says, you must be your own advocate, do your own homework. Vanessa says, thank you so much for sharing this information. We have a question from Laurel, and we're going to probably wrap it up after we do this. She says, do you find that people are typically satisfied with their cosmetic surgery, or do they end up wanting do-overs or tweaks that may be unattainable?
That's a good question. It's a really good question.
So I think this again goes back to kind of setting you and the patient's expectations. I will say cosmetic surgery is more, well, I won't say it's more challenging because some of my reconstructive patients can get very, very specific, very particular as well. But really it comes down to setting expectations. You know, I had to learn as my practice evolved. I train residents, and sometimes my residents, after I have an interaction with a patient, they'll be like, gosh, that was kind of harsh in some respects. But when I talk to a patient, you know, I have to show patients and say, okay, for example, I'm going to do a breast reduction. We're going to lift your breasts. I'm going to put your breast back up here. When you look down now you're going to see your stomach.
Yes.
And your stomach sticks out. So your stomach sticks out now, it's going to stick out after I do the breast reduction too, because I've had patients come back and say, I don't know what you did, but when you took that out of my breast, you must have put it in my stomach. I've had multiple patients tell me that before. And it's just setting those expectations. So I think do I still have patients that come back and want to do tweaks or things like that? Absolutely. Because, you know, sometimes you get it really well. And, you know, with tummy tucks, there's things called dog ears. There's all kinds of things that can happen, and there are tweaks that can be done. But again, I think setting that, you know, trying to mitigate those expectations, make sure that you and your patient are on the same page so that they're not expecting, you know, everybody can't have the Cardi B body, not that everybody wants that, but you know what I'm saying, someone who brings in a picture of Cardi B, but they, you know, they weigh 210 pounds, you're not going to get that. And so you have to really kind of go through those steps and those motions. But in the sense of, you know, just because you have plastic surgery, you're going to have multiple revisions. No, I think if you select your surgeon carefully, if you talk about the operations, if you know what to expect, especially in skin of color, talk to your doctor about scars. The scarring, that's something that I think most plastic surgeons don't spend enough time talking about. And that can be very disheartening to patients because they're not expecting to see scars.
And what about the addiction, Dr. Bolden?
Oh gosh, yeah.
You have some patients that you have seen them for everything. And you're like, look, I can't fix anything else. I can't change anything else. And some people have an addiction to plastic surgery.
You can definitely.
Oh, they do. They do. I mean, and you know, it's my job as a plastic surgeon also to be, you know, it's okay to say no. You know, I can. There's some patients who I'll say, I don't think that's a good operation for you. So I do turn patients away. But I mean, plastic surgery is addictive. I think even from the first time you get a Botox injection, it's very addictive because
we'll have to have a skin segment.
Yeah, I mean, you really do. You see how like, okay, gosh, that just makes me look a little bit better. I feel like I look like I did, you know, 5 years ago or 10 years ago. And it kind of fuels you. And you're like, okay, well, what else can I do to look better?
They said during the pandemic that people were seeking out ways to continue to get their Botox. And you know, basically telling the doctor, please, I need my Botox. They're like, you're wearing a mask, you're at home. They were like, no, you do not understand. I need this. I need my lip injections. I need my Botox. I need all of this. So
we didn't even have toilet tissue, and you're trying to get.
Oh yeah.
The pandemic made a lot of needs and a lot of wants an emergency. You know, so to each his own, like they say, in terms of what they deemed an emergency. Personally, I need my toilet tissue and some other things. Okay? But you know, again, I understand and respect people's desires to again get Botox and any other treatment they find medically necessary. Tamara, take it away for us.
I was going to say, man, we could be here all evening, and we have so many people that are really engaged. They are putting their comments in the chat. We're going to have you back, Dr. Kelly Bolden. Again, a special thank you to the Arlington, Virginia chapter of the Links Incorporated for hosting tonight's What, How, Why Wednesdays. Thank you so much, Dr. Nikki Martin, the National Health and Human Services Director. She's also a member of the Arlington Links chapter, for being on. Also the chapter president, Suzanne Walker, and the Arlington Links Health and Human Services Chair, Dr. Yolanda Holmes. Thank you to all of my Link sisters for being on this evening and supporting. That's coming from the North Broward County chapter of the Links down here in Fort Lauderdale. So thank you very much. Don't forget, you can check out, we put it in the chat part of the Facebook, but you can find Dr. K on myuzima.com. Be sure to sign up for her email at talkback@myuzima.com. Dr. Bolden is at Cultural Plastic Surgery in Chevy Chase. And we would love to see you all next week for the What, How, Why Wednesday on Instagram at Hey Dr. K. Until then, I'm Tamara G from 101.5 Lite FM, Odyssey in Miami. And we will, and to all my two Texas sisters on here, love y'all much.
A special thanks to Michelle Bailey of the Links. You worked so hard to make this happen. So we want to make sure we say that. And, Dr. Bolden, I know where to find you. I'm looking forward to a walk with a little one through Rock Creek Park and another discussion. Okay.
Yes, this has been a pleasure. My pleasure. I would love to come back. So please feel free to reach out anytime.
Will do. Thank you so much, everybody.
Bye.
Next Wednesday on Instagram. Bye-bye.